the laboratory investigations for dengue. So lab diagnosis is done to confirm the case of dengue. So we can confirm by directly isolating the virus, or by indirect methods by showing the antibodies which are formed against the virus. So direct methods and indirect methods. In direct methods, there is virus isolation, genome detection, NS1 antigen detection. In indirect, we can do the serology for IgM and IgG antibodies. So now we can see NS1 antigen detection. So we are going to find the non-structural protein of the dengue virus by ELISA and ICT. So ICT is immunochromatographic test, and this test is highly specific and it can differentiate even the serotypes. So dengue has 4 major serotypes and 5th one is newly found. So Dengue 1, 2, 3, 4, 5. So this test can differentiate all the 5 into separate groups, and this test can be done from day 1 of fever till the 18th day. So it could be done till almost 2-3 weeks. And the first 4 days, if it is a primary infection, the sensitivity is almost 90%. So it has high sensitivity. And if it is a secondary infection, the first 4 days it will be 70%. And this test is almost you can call this is the confirmatory test for dengue. And coming to virus isolation, this test should be done within 5 days of symptoms. So this is not ideally preferred because we may not get the sample within 5 days of the symptoms. So this is only done for research purposes. So this is a mosquito cell line. It is called a C6 or C36 mosquito cell line. So you can see the dengue virus growing inside the endoplasmic reticulum of the mosquito cell line. So we can also cultivate this in mouse. And this test is also highly specific and sensitive, but it can't be used in clinical practices. And coming to indirect methods. So this is the most important method, so antibody detection. So we are going to detect the antibodies against the dengue virus in the patient's serum. So firstly, we are taking a microdata plate in which the anti-immunoglobulins are coated, and then the patient's serum is poured inside. And if almost all people contain IgM in their blood, so even if it is a non-dengue IgM or it is against dengue, it will get coated over the plate. It will get attached to the anti-IgM. So then we are giving artificially prepared dengue antigens, which is connected to a biotin avidin complex. So this thing is an avidin biotin complex which gets color changed when the dengue antigen reacts with the antibody. So by this method, we can even differentiate the dengue into 1, 2, 3 because that antigen prepared will be specific to one serotype. So now coming to the primary and secondary dengue infections, in antibodies, the IgM, it will rise after 5 days of fever and it will remain till 90 days. So we can detect IgM from 5 to 90 days in primary infection. And by day 5, almost 80% cases will be positive for IgM. And by day 10, almost 99% cases will be positive for IgM. And coming to IgG, it will be present from 14 to 21 days and it will be present almost for lifetime. And coming to secondary infection, in this infection, the IgG, it starts rising even from the first day itself because it is a secondary infection. So there will be memory cells and it will start rising rapidly, and this will react. Actually, the IgG of flavivirus and dengue cross react, so it might not be more specific. And even in past infections, if the patient has already had a dengue infection, when you're performing the test, the IgG will be positive because it remains for life. And this method we are doing is called as MAC ELISA. So it's a double sandwich ELISA, which is done and is highly specific to serotypes. And coming to RDT for dengue, so RDT is rapid diagnostic kits, test kit, and it is either there will be IgM or NS1 antigen, but this method is poorly sensitive and specific. So the Indian government passed an order in 2016 stating that even if it is a positive and rapid kit, it should be confirmed with NS1 antigen ELISA or with antibody detection in MAC ELISA. So coming to the molecular methods. So molecular methods, we are using real-time PCR, and even in this method we can classify it Dengue 1, 2, 3, 4 because it is also highly specific and it targets the gene for viral RNA 3' UTR region and is most sensitive, almost 90% sensitive and specific for 95%. But another disadvantage is even this test should be done within 5 days of symptoms, like same in the virus isolation test. So even if it is negative in this molecular method, as it might be in patients after 5 days, So it should be confirmed by serological investigation. So serological like IgM. So IgM start rising by 5 days. So we can confirm with serological. So tourniquet test. This is not done in lab. It is done in clinical practices. So this test is a capillary fragility test. So in this method, we are placing a BB cuff and we are inflating it midway between the systolic and diastolic pressure, and we are maintaining this pressure for 5 minutes, and after then wait for 2 minutes, and we are counting the pedicle spots in this region. This is the anterior cubital region. So if the pedicle spots are present like more than 10 per inch square, then it is considered as positive, and it is present in only 50% of the cases. So it is not highly sensitive, but it is in clinical criteria. Then coming to thrombocytopenia, and in this one, thrombocytopenia, there will be less than 1 lakh cells per millimeter cube. So if you see in oil immersion, we can only see less than 1 to 2 platelets per millimeter cube. And now coming to prevention of dengue. So dengue can be prevented. The only vaccine which is approved for dengue is Denguvaxia. It was approved in 2015. It was developed by Sonafia Pasteur. It is a live attenuated vaccine, and the full form is chimeric yellow fever tetravalent dengue vaccine. So we are using the yellow fever virus 17D virus as a vaccine vector. So it carries the antigen and it targets all the 4 Dengue 1 to 4. Then there are some limitations for this vaccine. Actually, it can be used only from age 9 to age 45, and it can't be used in pregnant females, and it can't be used in immunodeficiency states like HIV, and it can't be used for persons having allergic reactions. So, and coming to the schedule of this thing, it is given as 0.5 ml dose into 3 doses and a gap of 6 months, and it is given in subcutaneous route. And this is available as lyophilized form and powder form, should be mixed with normal saline before injection, and efficacy is almost 80%, and it has many disadvantages, many side effects. So WHO has recommended that this should be used only in countries where zero prevalence is more than 70%, and only for people who are already infected with dengue, because in dengue, second infection is more aggressive. So if you are giving the vaccine to an unaffected people, then this will serve as the primary infection. When the real dengue comes in, it will serve as secondary and will be more aggressive. So only for people who already got dengue, we are giving this as an prophylaxis, not get dengue again. And as there are many safety issues in this vaccine, it is not yet approved in India for use. So thank you for watching. Goodbye.